Hi everyone, and welcome to another video. In this one, I'd like to answer a question about asthma inhalers. So this is the one that I received here. So apologies for the non-English commentary, but I'll try to read it so that it makes sense. So from AGP, Doctor, how do we know we inhaled correctly? Because when taking the inhaler, I couldn't feel the medicine and my asthma level has increased. And I feel I'm struggling to breathe now. So basically, this is a common thing that happens, especially with certain inhalers. In this case, it's about Symbicort, but there may be others. You may not feel a certain taste in your mouth when taking the inhaler, and that can be for many reasons. Some inhalers, like Symbicort, do not have a taste, so the powder that you're inhaling may not have a taste. Or everyone's taste is a little bit different, and that's actually a fascinating topic. So some people will feel the taste of an inhaler, some people will not. And then the third factor that plays into this is how correctly you are actually taking the inhaler. So obviously all these things matter. So inhaler technique is a matter of great struggle for some patients especially. And not all inhalers are created equally. Some people find certain devices better than others. For them, it's down to personal preference sometimes which inhaler device is the best for you. So if you are looking for a way to know whether your inhaler technique is good, first of all, you can probably take the inhaler with you to your consultations and show it to your doctor, check your inhaler technique. Because, like I said, you can't always rely on the taste alone. So you may need to check it with someone who knows how to use the inhaler. So they will guide you. They'll give you some feedback whether you're taking it correctly or not. And it's a matter of learning how to use it over time. You will not know how to use it perfectly from the beginning. And this is a common situation, especially when you're switching to another inhaler. It may be that initially you will struggle with your technique for a few days. It doesn't mean that your asthma will lose control. You'll lose control of your asthma within a few days. It usually takes a little bit longer than that, especially if you have been taking the inhalers correctly up until that point. But I think the best thing that you would want to look out for, the most important thing you would want to look out for, is whether your asthma is indeed as well controlled as before. If you've been on a new inhaler for a few weeks and you feel that you're getting more asthma attacks, you feel that your breathing is not as good, probably the inhaler technique may not be as efficient. So it's a good idea to then talk to your healthcare provider, whether it's your doctor, maybe the pharmacist who gave you the medication, maybe the asthma nurse. Depending on where you are in the world, many people may be involved in the care of asthma. But I think that's the main thing. If you are on point with the asthma, it's well controlled, you probably are using the good inhaler technique. But if your asthma is not controlled anymore, probably it's a good sign that you need to go see your healthcare provider and try to get some further advice on whether you can improve your technique. Maybe you need an add-on medication. Maybe there's been something else that happened in the meantime that made you lose the control over the asthma, such as a viral infection, something else that's new. So there's a lot of variables at play. But I would say your best bet is whether your asthma is well controlled or not. If it's well controlled, likely your technique is good. If it's not well controlled, it's probably time to review the technique with someone who can actually see you doing it. So taste-wise, it's very hard to tell. I hope this was helpful, and if you have further questions, I'll try to answer them in short videos like this one. All the best and good health.